Good morning. My name is Mrs. Singletary. I am an instructor in the medical assisting department. I also teach in health information technology and inpatient care. I'm going to talk to you a little bit about medical assisting, the program itself, the different options that we offer. I did hand out the 3 different degree plans. If you just kind of keep those in front of you, I'm going to talk about the benefits of each one. I also handed out a flyer that gives you additional basic information in case you all have any questions. Like Mr. Williams said, I did go through the program myself. I also took this class myself, so I know all about your all's binder nightmares that you all have to do. We can talk about that off record. But I, as yourself, also was inquiring about different nursing programs. If any of you have applied and gotten rejected or feel like you'll never get in, don't give up. What I actually, applied several times into several of the nursing programs and noticed that I was either missing a prerequisite or a point or a class or whatever the case is. So when I heard about the medical assisting technology program, it interests me because I already had a lot of the classes, the core classes that they were requiring, which may be the case for you too. If you'll notice on the associate's degree, there's some courses they require medical term, Spanish, speech, composition, lifespan, all of those classes, because they're required for other programs too. So that may be the case for you, and if you have taken them and you've passed them, then you can kind of put a check mark and you would not have to retake them. But I'm going to talk to you a little bit about why.
The screen.
Oh, I have to.
No. Yeah, like click the picture. There we go.
It's why choose a career in medical assisting. It says if you're a nursing student or you're interested in an allied health major, this may be the route for you. What I do want to say at first is we're in no way here trying to discourage you from your long-term goal. Some of you already have an idea of what you want to do, what you want to study. Anybody here want to share with us what program they're interested in applying into?
Physical therapy.
Physical therapy? Okay, anybody else? Any other programs? I'm sorry? Rad Tech. Okay, so some of those classes that we require in medical assisting are also required in the other associate degree programs. And the reason I ask is because, like I shared my experience, I was also trying to get prerequisites out of the way. So when I found out about the medical assisting, that it would take me a lot less time, I thought it was interesting that I could get something while I worked on my long-term goal. And that's the idea. That's what I want you all to understand. That I don't want to persuade you away from your overall goal. This is just something that you could possibly earn while you're working on, and getting into one of the programs. I like Mr. Wayne's computer here. Well, it does say that approximately 6 out of the 16 hours can possibly transfer to another allied health program. Sorry, I'm not familiar with this smartboard. So on your way to actually pursuing your long-term goal, you can see the degree plan to see if maybe this is something that you can take in the meantime. If you look at your MOS, the very first degree, the certificate that I handed out, if you notice, we have it catered to where you can actually get your MOS certificate, MOS meaning Medical Office Specialist certificate, in 1 semester. Now keep in mind it is first come first serve. We're not a select program. You don't have to apply and wait and on a point system, anything like that. pretty much all we require is that you have a 2.5 GPA, and that you don't have to be TSI complete for the MOS, but if you want to continue further to the other certificate we have, you would need to. So we're encouraging all students to get TSI complete and get that out of the way so that you can just keep going to get your associates. So if you notice there on your degree plan, make a note, an asterisk next to the second one, administrative procedures, medical insurance, and medical law and ethics. Just kind of make a little note, check mark, asterisk. Those 3 courses there are mini-mesters. As most of you are aware, a traditional semester is 16 weeks, right, from beginning to end. A mini-mester would be half of that. So we have those courses set up to where the first 8 weeks, you take those 3 classes, you get them out of the way, and then the other 8 weeks, it's when we would send you out to the clinic to get your internship done, which is 144 hours. So that is how we can actually get students to take 16 hours, I believe it is, and get all of that done, including the practicum, in 1 semester. And that is, I have students that I've placed in clinic. I was sharing this with the other class, that I have 38 students out in the clinic, and this semester, so far 11 have been hired, which is a good number because if you think about it, it's just internship. They really don't have to hire them. So once the students complete the first semester, then they come back. If you look at the second page, the MAT, Medical Assisting Certificate. If you notice, the first semester is the MOS. Everybody has to go through the MOS. They come back for 2 more semesters, then they get their Medical Assisting Certificate. While they're in the Medical Assisting Certificate, if you notice, phlebotomy is a course, and electrocardiography, that's EKG, is another course. Those 2 classes, if you take those and you pass them, you have the option to take the National Certification Exam. That just makes you more marketable, and a lot of the hospitals are requiring that you have some sort of national certification, in addition to just taking the class. So the students already took the MOS. They came back for 2 more semesters, got the MAT certificate, and if you look at your 3rd page, 1 more semester, they came back and got their associates. So that's how our program works. We prefer all the classes in the first semester do have to be taken first before you can move on. But after that, it doesn't matter, what classes you take. We prefer that you follow this degree and stay with the first, second, third, and fourth semester. But we can work with that. So the beauty of this program is that, number 1, you end up getting an MOS. Then while you come back and you're in the MAT certificate, you walk away with a phlebotomy certification. That's where we teach you how to draw blood, and an EKG certification. We teach students the electrical current of the heart. And then after that, you take your MAT certification exam, and then you get your associates. So if you notice, there's actually 5 credentials that you can get while pursuing the associate's degree. Now keep in mind, this is while you're waiting to get into or complete the prerequisites for your long-term goal. It can be a quick program. We have what we call a fast track. Like I said, some of you have already taken some of those classes. Maybe it wouldn't take you the 4 semesters. If you've already taken those classes I mentioned, Spanish, speech, composition, medical term, college algebra, it may take you less than a year. I know when I went through the program myself, I was able to get the associates in 2 semesters and a summer because I had all those other classes. So that's where we consider it's a quicker fast track. It allows you to be able to get credit for all the previous classes you've already taken. And you can start the spring semester. We do have some classes that are filled up, but we have openings, a few openings in others. It allows you to expand your career options by going the Associate of Applied Science route. And with an associate's degree, you're not limited to just the medical office. I know that when I found out I could teach with an associate's in medical assisting, that was an interest to me. So that's one of the reasons why I went through the program. Maybe that's the case with you. They do allow you to teach with an associate's and 1 year clinical experience. What I did mention before is the MOS, I want you all to understand, is a medical office specialist. That allows, we train those students to know everything as far as administrative work in the front office. Anything having to do with the reception, filing, billing, anything along those lines, that's where we would teach you in the first semester MOS. The second, third, and fourth semester is where it's mainly the clinical side of it. We teach you everything you need to know, from administering injections, writing out prescriptions, performing vital signs. We teach you how to process labs in the medical office, all those things. So you can actually work in the hospital, medical records, laboratory, or even pre-op. And you can work in the area of management. And like I said, you can teach here at STC or one of the other technical schools. It says we have highly qualified instructors. We have a physician assistant who happens to be our program chair. We have MAT graduates, adjunct faculty members. We have a physician on our advisory committee. We have, and a nurse too. You'll learn a variety of skills. Like I mentioned, you'll learn how to draw blood, give injections, allergies, TB screens, perform routine lab exams like urinalysis, CBCs, EKG with interpretation, obtaining vital signs and patient histories, prepping the patient for an exam and assisting the physician, and writing medication. You actually also learn how to calculate dosages, which was really interesting too. The difference between a medical assistant and an LVN, if you notice, if you've been to the doctor recently, you've seen a medical assistant, because a medical assistant nowadays does everything an LVN used to do, just about everything. So our students that we're sending out to the clinic are, multitask, because if you think about it, they already got their MOS certificate to work in the front office. They got their phlebotomy certification. They got their EKG. So they can pretty much help, they're in anywhere in the healthcare facility with the experience that they gain. It says here in the Rio Grande Valley, the pay ranges between $8 and $14 an hour, and some students start working immediately following graduation. Now that's not you see the $8, it's not a lot, but what a lot of these clinics are doing is they're hiring our students while they're at the clinic getting their internship done. That's supposed to be volunteer work, if you think about it. So our students, some of them are actually getting paid to get their internship done, which is nice. The students really like that. And some of them actually go to the hospital setting. Now, one thing I didn't mention is there are several one-semester certificates that they're offered here at STC. We have one, medical assisting, the medical office specialist, and patient care has another one. Some of the classes are identical, because I've actually taught phlebotomy and EKG with the exact same book in patient care. The only difference is the training. The training in patient care is done in a hospital setting, and the training for a medical assistant is done in a clinic office environment. So that's the difference between two. A lot of students come and tell us, well, I don't know if I want patient care or medical assisting. That should be the deciding factor for you to determine whether you want to work in an actual hospital setting or in a clinical doctor's office. It says the MAT program is 3 semesters long. A student is placed in the clinic in the first semester, and upon successful completion, student will earn a certificate in medical office specialist. And then I explained to you about the second, third, and even the 4th semester where you come back and get your associates. We are a proctoring site for the certification exam. Some programs you actually have to travel out of town or even away from campus. The certification exam company that we use actually comes here and proctors their exams. And our students are able to obtain more than 1 award, up to 4 credentials for the price of attending school. Now, a topic I like to cover is, some of you have heard of some of the proprietary schools that come out on TV that offer medical assisting. It's probably the exact same certificate with the exact same courses. There's only one big difference. Does anybody know what that is? Cost. Yes, thank you. Both, and they do say they take financial aid, and they do. They're right. They do accept financial aid. I know when I was a student, the Pell Grant was amazing because I never had to pay a penny for my education. So when I saw their advertisement, I thought, well, they take it, I take it. They say 6 to 9 months. The only difference is if you come here to STC, the cost is, let's say the average student gets $5,000 a year, right, for Pell Grant. You don't have to pay that back. And usually that's per year, so it's $2,500 per semester. Well, these other schools also take the $5,000 you get. The only difference is their cost for their program is $16,000. And they take financial aid, don't forget. However, they only take $5,000 in financial aid. Somebody else has to come up with the other $11,000. So I don't know if you've heard, you know of someone who's gone through that. I have about 4 or 5 students this semester who actually went through one of those schools, didn't get their certificate because they failed to finish paying the $11,000. So it's about the same amount of time. They both take 6 to 9 months because if you think about it, the MOS certificate you can get in less than 6 months in just one semester. And financial aid will cover all your classes for full time, plus probably even leave you with some extra book money, allowance money, which is money you don't have to pay back. So that is one of the things I like to talk about because that was a huge decisive factor for me. I know I don't have $11,000 just hanging around. Plus another thing is they're not college credit. So if you go and you get your medical assistant from them, that's fine. You'll get your medical assistant experience, but you can never move from there. Nobody ever says, I want to be a medical assistant the rest of my life, right? Or medical office specialist. Nobody ever says that. You get skills so that you can sustain yourself while you're acquiring your long-term goal. So you can do that here too. The beauty of getting it done here at STC is that you get college credit. So you can move up, you can apply into other programs. Like I mentioned in the beginning, some of the classes you would get credit for the other programs too. So I wanted to make sure that you all understood the difference in that. Like I mentioned, the intent is not to discourage you from your overall long-term goal. It's just maybe something that you can do while you reach that goal. Some of our students are involved in conferencing, counseling, front desk computer skills. They're performing vital signs. Our MOS students are filing, drawing blood on patients, documenting, confirming results, assisting the PA, nurse practitioner, or the doctor, sterilizing instruments in the lab, and even managing the clinic. We do some fundraising, and our students are involved in the community. So there is a lot that we do with our students. Like I mentioned, it is affordable. Financial aid is available. And that is our secretary's phone number, Ms. Alicia Resentes. If any of you are interested in attending our next group advising, I'm not sure when the next date is, but she has that information that you could call her directly, or she's on the second floor. And then of course there's the information for our program chair, Ms. Rodriguez.